I am Eric Klos and welcome to Book 101 Review. Book 101 is all about the books that I read for the last 40 years. And today I have my special guest. He is the founder, CEO of 10,000 Daily Breath, no other than Mr. Eric Klos.
Hi, my name is Eric Klos. I'm the CEO and founder of DailyBreath. DailyBreath is a cloud-based SaaS company that's delivering personalized environmental insights for better health outcomes. As you can see, I have a mobile app that actually tracks symptoms, pinpoints people's triggers, and then helps them reduce potential health impacts. And I've been doing this for about 9 or 10 years, and that's why I say that I've developed about 10,000 hours in environmental health. And so that's an emerging field, and it's connecting basically things like pollution and pollen with health symptoms that people are experiencing every day because of those issues.
Mr. Eric Klos, thank you so much for sharing your knowledge to the world. What inspired you to create Daily Breath, and how did you identify the gap in addressing environmental determinants of?
Sure. So about 10 years ago, what exposed me to this issue from a intellectual perspective was my sister had rheumatoid arthritis, and she was living with me at the time, and she came down and she had a flare up of her rheumatoid arthritis. And what that means is, her hands kind of curled up and were kind of rigid. And she came down and said, Eric, it'd be really interesting if you had a mobile app that could track the weather and determine what were the weather impacts on that rheumatoid arthritis, right? And the more I investigated, I learned a little bit more about rheumatoid arthritis or flare-ups are often prompted by precipitation, cold fronts coming in, warm fronts coming in, weather dynamics, right? And so it really struck me at the time, what were the weather and environmental determinants of health that were impacting health? And so that started a real intellectual journey for me. And what I determined was respiratory health, obviously with pollution and pollen and the way those issues intersect with the weather, that has an impact on people's health. Cardiovascular health is impacted by pollution. And then you've got things like migraines and headaches. And arthritis and joint pain. So when I started that journey, I realized that respiratory health, obviously because pollution is a real impact on people who have asthma and COPD, was an area that was really impactful. Certainly there's a personal impact on people, but there's also a tremendous burden on the healthcare system. There's a large number of asthma symptoms that occur every day. In the US, as an example, there was close to 30,000 asthma attacks occur every day. That's an exacerbation where somebody has breathing difficulty. And of those, 5,000 each day, an individual is going to the ER visit. So 5,000 people every day in America are going to the ER because they have an asthma attack that they can't recover their breathing. And then of those, 1,000 people actually are staying in the hospital maybe for 3 to 5 days. So when you see that, that's a huge cost burden to the system in general, as well as obviously a personal burden for the people that are experiencing these symptoms. And then, in the United States, 10 people every day die of an asthma attack. And obviously, what's transpired over the last 10 years is we've seen climate change emerge as an issue of a driver, of creating more pollution, creating more intense pollen seasons and stuff like that. So it's really a great opportunity to do something similar to what the Human Genome Project. The Human Genome Project really exposed, well, can we map our genes, and can we determine ways of managing health by leveraging what we know about the genome? And now what we're seeing is a lot of people are focused on exposures, right? And pollution and pollen are one example, but there's lots of chemicals that we have in our home. We have gases that going on in our home. We've got various pollutants and irritants in our home, and all of those really have an impact on our health.
And what does technology play in predicting and mitigating health risks from pollutants or allergens?
Right, right. Great question. So that was the other thing that was really great was realizing that at the time you started to see, obviously, with smartphones coming out, you saw, application of digital health or mobile technology that suddenly was emerging, and you also began to realize that, okay, well, wait a second, if you started to collect data, big data and artificial intelligence, you might be able to create some frameworks for creating personalized environmental health. And that's one of the goals of Daily Breath. We have a public health model where we distribute air quality information to individuals, and people are supposed to respond based on what they perceive as the exposures. But they don't really understand, well, how is it impacting me personally, right? And so what I wanted to do with Daily Breath was create a tool where you could track your symptoms, as you experience them. And over time, you could develop what I call a personalized environmental health risk index. And it's my, you know, proposition that people are more likely to take preventative action if they know what the personal impacts of those exposures are on their health. And so what we were trying to do was create that model. But technology is really what's going to be the great enabler for this personalized approach, because you have the ability to use this mobile health app to track these various things. And the interesting thing too is there's other areas of growth. Geolocation is one example, right? Your mobile phone tracks where you are, right? So one of the features of the Daily Breath app is that not only are we tracking the what, but we're tracking the where. So there's actually a community flare-up map where you can see where other people are experiencing symptoms in your community. And what's interesting about that, when you're tracking specific pollutants, is that can be a proxy for where pollution is problematic in your community. So maybe those are areas where you need to, promote clean air initiatives or maybe climate change mitigation.
Climate change mitigation. Have you encountered skepticism about the link between environmental factors and health?
Yes. So I would say what's been interesting about my journey is that initially I spent a lot of time at allergy and asthma conferences, talking to allergy and asthma specialists, sometimes primary care doctors. But I have to say, part of the thing that I've said from the very beginning is environmental determinants of health have really been neglected by the medical community. And part of that is a product of our system. We're rarely driven by what I call sick care codes, right? We're driven by kind of a concept of, well, our medical community is going to address sickness with a treatment paradigm. Whereas if you look at the world of environmental determinants, it's really about, well, how do we prevent people from having negative impacts from those environmental determinants? And there's not a lot of focus on that within the medical community. It seems to be more of a public health focus where you have community health workers and other folks like that who are doing investigations of indoor environments for patients and stuff like that. So yes, I would say that there has been some skepticism within the medical community. Last week, I attended something called the Exposome Moonshot Forum, which is an initiative aimed at trying to document all of our exposures. So it's kind of like the Human Exposome Project, right? Similar to the Human Genome Project. And that seems to be gaining a little bit more interest by certainly the academic medical research community, as well as some parts of the medical community broadly. But frankly, it's because to a certain extent, they are beginning to realize, obviously, with climate change as a driver, this is getting worse and worse, right? If the world's getting warmer, and we know that pollutants are much more dense in warm temperatures, and so that they're more easily inhaled, and therefore they're more problematic to our airways, then we're going to see an increasing number of people having problems if they have these conditions already. But we're also going to see people maybe developing asthma because of exposures to pollution and stuff like that. And that's something that's happened in recent years that has been somewhat documented. Things like wildfire smoke. What's the impact of 2 or 3 weeks of consecutive exposure to wildfire smoke? What does that mean for our longer term health?
In all. of us, how do you measure the impact of a daily breath on an individual's respiratory health outcomes?
Right. So what we're really trying to do is track at the time that they have an onset symptom, they're self-reporting within the app those symptoms. And when that occurs and they submit that symptom, it's connecting with a time and a place, and then the various pollutants and allergens that are information that's being tracked within the app. So there's weather data coming in, there's pollutant data coming in, and there's pollen data coming in to the app. And when they actually record that symptom, it's capturing all that. So there's 6 different pollutants, an air quality index, PM1, PM 2.5, PM 10, nitrogen dioxide, sulfur dioxide, ozone, all of these different pollutants. And at the pollen level, it's tracking tree, weeds or grasses, and the intensity of that pollen, a pollen count. Okay. And so what we're doing is we have a table that shows a view of what those variables are. And the goal is actually to kind of begin to trend analyze that information. And so people can begin to understand, well, wait a second, I'm having my asthma symptoms on days when nitrogen dioxide is high and it's 80-degree temperatures. So it's kind of beginning to get the person to understand what are the weather and environmental determinants that are causing them symptoms on a given day. But the goal in the background of AI and machine learning is to apply that and begin to understand, okay, how can I provide personalized risk index? So this number 5, the daily breath risk index, how can I make that personal for the individual? And then how can I create specific personalized alerts based on the information that the system has learned, right? So again, if they learn that 80-degree temperatures are problematic for somebody, then they might send a personalized alert to that individual's, on a day when it's 80 degrees, saying, oh, you might experience symptoms today. This might be a good day. So one of the things you see in the app here is on the left side, it's in green, it says an impact summary. And then the right side is recommendations. So not only are we actually digesting all this information and providing these alerts, but we're actually saying, here are the impacts, and here are some recommendations of things you can do. Maybe you can wear a mask. Maybe if most symptoms are experienced in the afternoon, you should go outside in the morning. There's various recommendations that you can make. And that's what I mean by preventative action. It's like we're not at the mercy of the weather and the environment. That's the perception that we have. And to be honest, that's a little bit of the perception that the medical community communicates. That, well, there's nothing I can do about the weather. Well, there may not be, but the fact of the matter is there are things you can do to empower your patients to understand how the weather and the environment may impact them, and therefore advise them on what things they can do to prevent symptoms from occurring. And we don't have a focus on that. What we have right now is a system that really waits for symptoms to be experienced, potentially even severe symptoms, and then treats them at the hospital, right? And we want to change that paradigm.
Mr. Eric, and what advice would you give entrepreneurs aiming to merge public health and environmental innovation?
So that's a great point, because that is one of the mantras I've said from the very beginning. I call this personalizing public health, right? Because there is a particular public health approach. And we saw with COVID even, right? There were a lot of public health recommendations, but how did you align that with, going to your own doctor, right? And all of those kinds of experiences. So I think that has been one of the challenges, and what we continually strive to do is try to connect those two universes. How do you bridge public health with the healthcare delivery system, right? So that we can have greater impact. The thing that is interesting about the data is as we start to accumulate this data, we have to think about how do we intersect this data with the actual healthcare delivery system and the systems that they use. So for example, what would we do with daily breath data, and how would we integrate it with an electronic health record at a hospital that's tracking that patient as well, right? And is there some type of interface that we can create that would allow the daily breath symptom information to be something that's available to a doctor or an allergy and asthma specialist. So the allergy and asthma specialist on a frequent basis is understanding what types of pollution and pollen and those types of things are impacting that individual's health, and may be able to configure a treatment paradigm, or maybe there's particular pharmaceuticals. I mean, this is an area where we actually are looking at, we're at the kind of the beginning phase of looking at personalized health or personalized environmental health and saying, well, are there ways of doing precision medicine, right? Is there a particular way of configuring which drug treatments we should be providing a patient based on what type of environmental exposures they're exposed to? We don't really know those things yet. We're really very much early stage in understanding that. So one of the things I always constantly tell folks when it comes to environmental health, we're really in the second inning of a 9-inning ball game, because we don't know what we don't know, number one, on the pollution side. But on the other side is we also don't know how to connect, if we are indeed exposed or more sensitive to a particular exposure, how do we change our susceptibility to having an experience, right? So there's two components that result in an exacerbation. One is what's your individual sensitivity to an exposure, and the second is what's your personal susceptibility to having a symptom based on your physiology. Because what we've learned is pollution and pollen impact our airways, and they impact it depending on what type of inflammatory response we have to an exposure, right? And that's one of the things that's progressing within the medical community is, we're learning more about what are the genes that cause what's called type 2 inflammation. And then what are the things that we can do to lower inflammation so that potentially when we experience a exposure, it doesn't cause symptoms or it doesn't cause respiratory difficulties. So we do have a ways to go there. But, that's part of the reason I really enjoy what I'm doing, because, I feel like we're on, the leading edge of a domain that's doesn't have a lot of participants. There's a book I read a couple of years ago called Blue Ocean Strategy, and so from an entrepreneur perspective, pursuing an area that doesn't have a lot of sharks in it, right? They're not eating each other, right? So you go to the blue ocean, right, instead of the red ocean where there's a lot of blood, right? And so that's an exciting part of this, is that it's all new and it's all fresh. There's lots of research being done around the topic. And all of that begins to inform how my product evolves over the next, 3, 5, 10 years.
Mr. Eric, as a founder and CEO of DailyBreath, what your short-term and long-term goals?
So basically, I'm in the process of making the company basically profit bearing, right? That's the first step. I've made, had initial investors. At some point, I decided to stop, seeking investment and really bootstrap the company to a revenue, profitable path. And then the idea is really to grow the business. I mean, I have this big, hairy, audacious goal, which is to become the largest environmental health, intelligence, and wellness platform in the world. The product recently went through a pivot. I was focused on allergies and asthma previously, but I decided to expand to the air you breathe and your health broadly, so that the app is going to aim to, bring in users from around the world and really associate the environment and their exposures with whatever conditions they have, or if they have no conditions, right? We want to track, if they have no conditions, do they develop conditions because of environmental exposures over time? So the product will continue to evolve. I have a development roadmap I'm working on, which will introduce more functionality and features to the existing app, as well as probably build a more premium version of the app in the future so that it can go more to a monthly recurring revenue model. So it might be available for 29 cents a month or something like that, as opposed to 99 cents annually. But the idea too is also to develop the back end data. And as the back end data develops that, hopefully that data will be more valuable to the marketplace, including pharma companies, potentially governments, and stuff like that. So we'll make that data available because it correlates actually the health experience of citizens in communities with these environmental exposures.
Good luck to your goals, Mr. Eric. And how does your company advocate for systemic changes in policies related to air quality or urban planning?
Right. So I think that's part of I always talk about upstream interventions, right? So when I'm focused on upstream interventions, I'm focused on things that people can do themselves personally. But the greatest upstream intervention really is trying to clean the air, right? One of the things I do is I have a bunch of affiliate partners that I have that actually help you clean the air. So you might have seen recently, there's things like Respiray has a wearable that you put around your neck, but it's an air purifier, personal air purifier, right? It cleans the air that you're breathing, right? So those are the kinds of things I support. But the ultimate upstream intervention is policy, right? And part of the thing that I think is important about the map is that as we track flare-ups in a community, that is a proxy for where pollution is the most problematic, or where pollution is causing specific people with specific condition, patient populations, people with asthma, people with COPD, people with cardiovascular health issues. You'll be able to see that, hey, there's a large number of people that are experiencing symptoms in this part of the community, and that could support local policy, certainly potentially state policy. Every year, you've got organizations like the American Lung Association, the Allergy and Asthma Foundation of America, identifying specific cities that are problematic for pollution, or there's an allergy capital series that AAFA does, where they identify allergy capitals. So I think that you can suddenly use Daily Breath as a vehicle for identifying where should we be implementing policy. And certainly the more we use Daily Breath to connect this intersection between environmental exposures and actual impacts on personal health, I think the greater the argument is for climate change mitigation, right? And taking action. Because we found, in communities that, are walkable, in communities where there's less vehicles, in communities where people are adopting EV vehicles more aggressively, there is a reduction in pollution, right? And so I think that hopefully the purpose of Daily Breath is to support that messaging. I don't want it to be a distraction, though, from the core issue, which is, what we need to do today is figure out how do we, prevent people from dying. There's 10 people who die in the United States every day due to an asthma, what I call a potentially preventable asthma death, right? And that's something we have to figure out how to prevent. There should not be that much suffering associated with a death that is potentially preventable. There's steps that can be taken. There's parts in the care paradigm for these particular conditions that we can address and hopefully avoid that suffering for that individual and that family, and those have dramatic impacts. I didn't talk too much about that, but that was one of the things. Shortly after I got the inspiration to pursue the path, and when I was developing Daily Breath as a prototype, one of the stories that I read about a young 15-year-old girl in Iowa was she had an asthma attack, and the internet article that I read said, doctors are trying to pinpoint the trigger for this young 15-year-old girl who's in the ICU. And it struck me, why are we trying to pinpoint the triggers after the fact instead of trying to pinpoint the triggers, before she has the incident where she had an event and was in the ICU? I was also surprised to learn that occurred in 2017, and this young 15-year-old died recently in December of 2024 at the age of 23. And these are what we call premature mortalities. These are people who potentially really should not be dying of their condition. And yet, because we don't have these steps in place to potentially prevent asthma attacks. People are experiencing them, every day. And so that became a real passion for me. That's why you see pinpoint your triggers as one of the models. And that's why you see pins on the map. We actually have pins because we wanted to pinpoint where people were experiencing those symptoms. So I'm very passionate about the topic because, I think, unfortunately, we have too much tolerance for some of these very serious impacts, to these patient populations. And I personally am not affected by asthma myself or anyone in my family, but that particular type of story just really resonated for me, and I think it's just unacceptable.
Prevention is better than cure. Mr. Eric, how do you envision daily breath adapting as a climate change intensifies allergens and pollution?
Yeah, so I mean, again, I think part of it is being, in a sweet spot where, you know, we are identifying that climate change is a driver for specific changes in weather conditions. And what we're learning is that those weather conditions have impacts on pollution and pollen, right? That increases the risk for certain populations. And so, like, one example I'll give you is, and this is unique. Wildfire smoke is very dynamic, right? And so one of the things that we're going to be trying to do is tracking the plume for a wildfire smoke and seeing and tracking those symptoms, right? So are people experiencing more symptoms beyond just daily air pollution, right? Because of a wildfire smoke event. And then the other part of it is, okay, within the app, can we track how many days is a particular person exposed to wildfire smoke for a long period of time? And what's the long-term impact on health? Like, one of the things that we've learned through research is that like pregnant women are being impacted because the babies in their body are developing asthma later. So we know that their exposure to pollution is somehow, in fact, impacting that pregnancy in a manner that's having impacts on the baby in the womb. And so that's really, really interesting. And so what we see is, like, climate change is causing certain changes in the weather, certain types of extreme weather events. Another example of an exposure that's been really in recent years understood in much greater clarity is mold. Okay, mold is a real problem, and for years we haven't really understood how toxic mold is to our health. And so we're learning that, these precipitation events, there was a huge Hurricane Helene recently, right? That blew up the eastern seaboard, and 32 inches of rain over like 24-hour period or something like that. Crazy. But one of the bigger challenges, a lot of those homes just have not been inhabitable because, after 3, 4, 5 weeks, they actually had fairly warm temperatures afterwards too, and they have mold in their homes. Any roof leaks that people have, roof leaks lead to mold in the attic, right? So there's a lot of things that you're seeing climate change be a driver for changes in the weather, more extreme weather events, and that ultimately will have greater impacts on pollution and pollen. One of the reasons people are experiencing a very severe allergy season on the East Coast is specifically because of Helen, right? If you have 32 inches of rain, what do you think the impact of that is on plant growth, right? In those areas, right? So trees bloom, and they've got lot more pollen on them, and so allergies are much more severe this season, right? So yeah, those are the kind of tangential results you have, or impacts you have, as a result of climate change leads to extreme weather, hurricane in this case, which leads to increased precipitation, which leads to increased pollen intensity the next season, right? So that's the correlation, and I think you're going to see those correlations documented through research, certainly through tools like DailyBreath. And, the hope is that, by connecting all that together, it gives people, a sense of, okay, yes, climate change is something we have to address, and we have to address, in practical terms, but it's something that, our health depends on it. right? And so it's one of the bigger impacts. And so we have to figure out a path forward to address climate change. And I think that ultimately becomes part of the policy debate. Certainly, health will contribute to people understanding the dramatic impacts and potentially motivate, the system to move towards reasonable policies.
Mr. Eric, before we wrap up our discussion for today, I'm inviting you to please do listen to my other podcast, people, because my abstract essay is already in 5th season, abstract poetry in 2nd season, and book 101 review in 5th season, comedy 101 in 2nd season, and food 101 in its 5th season too, geography 101 in 4th season, love letters in 3rd season, and my baby podcast, Mental Health 101, Movie 101 review in 4th season, Music 101 in 3rd season, and Science 101 and Sex 101 in its 1st season. Please listen to them wherever you listen your podcast. Mr. Eric, if successful, what legacy do you hope Daily Breath leaves in the health and sustainability sectors?
Yeah. So I mean, that's the big thing for me is I'm really hoping that the legacy is something I call the Perry. So you start out with the daily breath risk index, and that risk index was based on some climate research that correlated weather and environmental data or thresholds that were met that caused asthma attacks and or allergy symptoms, right? So that was the baseline. It's a study-based evidence algorithm. But ultimately, as you gather more evidence for each individual, the goal is to develop what I call the Perry Index. So Personalized Environmental Health Risk Index. It's the Perry score. So, my dramatic goal, I think, would be that somehow we develop a Perry score for each individual that can represent kind of a metric that can be tracked by the individual themselves, as well as they potentially could even share it with their doctor, and that doctor would be able to see the same dynamic information that's on my mobile app because it's connected to their EHR. They would see, oh, that person has a higher risk of having having a health impact due to the conditions that day. And so maybe they would be the ones who proactively had someone contact that patient and say, hey, listen, we noticed that your Perry index is high today. Have you taken precautions? Are you running your air purifier today inside the home? Are you wearing a mask when you go outside? The thing that people don't realize is sometimes, climate change could make things worse before it gets better. And I always use movies like Interstellar or Elysium as kind of examples of times or movies that project a future where the world is full of a lot of waste. In the case of Elysium, or in the case of Interstellar, it was a lot of dust storms and things like weather conditions that were creating very bad conditions on Earth. And I try to relate that to people and say, listen, this is a model that really we need if things get worse, because we need people to be able to respond, to the pollution outside and recognize that, yes, in some cases, I mean, we're a people that wants to go outside and spend time outdoors. But sometimes you need to stay inside. And the second part of that is if you're staying inside, you're still exposed to lots of pollutants, right? And pollen. And you have to take steps in your own home to take precautions to prevent those negative health impacts. I envision a day when, an air purifier will be something a health insurance company pays for because they understand that an air purifier is essential to maintaining clean air in the home. And it's a preventative measure that should be taken because it potentially can prevent asthma attacks or COPD attacks or stuff like that. So my big footprint is really to bring this personalized environmental health focus to the industry and really have that impact. From a sustainability perspective, again, it's trying to connect the idea that if there are opportunities for us to implement things that have the dual impact of mitigating climate change and at the same time cleaning the air we breathe today, right? Then those are initiatives we should be looking at because it impacts a broad community. But I'm also very, very focused on what can I do for you as an individual and empower you to take action to prevent what those environmental exposures could do to your health.
Mr. Eric, can you recommend a book that influenced your journey?
I could, a lot of them. From a health perspective, The Patient Will See You Now from Eric Klos. He actually has a section where he talks a little bit about this particular aspect of literally technology allowing us to get to that granular level of impact on a particular condition, those environmental impacts. That's one of them. Another book called Upstream by Dan Heath. Again, that's kind of the concept of, instead of waiting for care and for the burden of cost of care and all of that kind of stuff, what are the things we can do upstream, so that there's not this downstream impact that has a dramatic cost to it. And so from that perspective, that's another book that I've focused on. And then again, going back to the original discussion about Blue Ocean strategy. That's another book. I realized that there are not a lot of players in the environmental health place from a business perspective. I mean, there are companies emerging that focus on mold inspection or focus on various parts of these things. There's certainly air purifier companies, but when it comes to actually saying, hey, environmental determinants, the environment is a determinant of health, and what are those things that we can do to connect that data and so that the person associates those impacts, but then convey to them and build a program for, here are things you can do from a preventive health and wellness perspective to just mitigate those potential impacts. So I learned that early on. The other book, I think from a product perspective, would be Hooked. A gentleman by Nur Ayal writes a book about Hooked. And so a lot of the things that I've implemented into the product, things about sharing the app, things about the community flare-up map, they're ideas of trying to hook people into what's in the app so that they know, if I start to populate this with data, I'm going to get something back, right? If I track my last 5 symptoms, then I get a table view of those symptoms, and I begin to associate what are my problem, weather or environmental variables. And then, the community flare-up map is another way, or it records my symptoms. So I know where I'm experiencing symptoms in my community, which is another risk variable. So those are some of the books that have been influential.
Mr. Eric Klos, thank you so much for sharing Daily Breath with the world and, of course, your recommended books. So can you please invite our listeners to support your Daily Breath?
Yes, so Daily Breath is available in the Google Play Store and the Apple App Store. Just search for Daily Breath. I also have a Substack, .dailybreath.com, where my environmental thought leadership is provided. And you can visit www.dailybreath.com to learn more about Daily Breath.
Yes, people, let's support Mr. Eric Klos, because if you support him, more and more and more empowering Daily Breath to come. Mr. Eric, thank you so much for your time.
Thank you very much, Daniel. I really appreciate it.
More to come, people. See you soon.